What's up, guys? Good evening. Welcome back to my channel. Thank you so much for clicking on this video. It is appreciated so much. How did I get 95 of you guys? That's awesome. Thank you so much. Last time I checked I had like 91 just before I went to Edinburgh, and I came back from Edinburgh and there were 95 of you. That is epic. I don't really care about massive numbers. I don't really care about plugging it everywhere. I just care that the people that are subscribed for the right reasons. So thank you. I know there's a big water drop community that follow me, still subscribe to me. And there's been no water drop action recently. I apologise for that. There's been a lack of funds. Just living is hard nowadays, it seems like. But I've seen that they have a new micro drop out and some new accessories. And because it was my birthday on the 16th of April, I've got more points as well. So I may do a cheeky little order of their new drop and then use my points to buy something cute. And then I'll review that. But this video is not about that. I've wanted to make this video for a very long time. It's been a mixture of not really knowing what to say, not really knowing how it's going to be received. The online community now, it can be really kind. It can also be really detrimental. And I've already been bullied about this particular subject for a very long time. And you would have seen in the description this exact subject matter. So it's not a shock when I start talking about it. But basically, I was about 12/13 years old when me and my mum realised that I had only grown one breast. Now that happens to be the left breast. And I don't mean a cup size difference. I mean the left looked like Jordan and the right looked like a pigeon, like flat chested, nothing there, nada. So we went to the doctors and I was referred to someone at a local hospital, a plastic surgeon. And he basically said that the task at hand was too big of a job for him. Bearing in mind, he was my local specialist and the job was too big for him. So that's kind of when you realise, even at 13, maybe this is a big deal. Maybe like what I've been going through and what I've been looking at in the mirror is not necessarily normal. It's my normal because that's my image, that's myself, that's what I'm used to for 13 years, that's what I've grown up with. But in a world environment, it's not normal. So he referred me to the East Grinstead Hospital, the Queen Victoria, to see my specialist, who I'm still under now, and I'm 39, bearing in mind I was 12/13, possibly 14. And we didn't operate until I was 16 years old. Now, he was amazing. My picture is on his website. And that's why I have no issue showing it, because it's up in the public domain anyway. You can't see my face, but you know what he's done. Basically, it shows off his work and it shows that that is me and what he's done. So basically, I will add the photo onto the end of the video, so please keep watching if you're interested in the results. But do bear in mind, the first photo, where I only have one breast, was taken when I was about 16, just before I had my first operation. And the second photo was like my third operation. You do not get fantastic results from your first operation, okay? Just don't think of it like that. Think of it as, I want to say a journey, and it's not a journey because we all hate that in this house. You don't go from A to B. But think of it as stepping stones. So the first one will lead you to your second. Your second could be the one and they get it right, or you may need a third just to tweak some things and pull some skin, take a little bit more away, whatever. So he was amazing. He spoke to me. He talked to me, even though my parents were there. It was very much about me. He drew me a very cute little diagram. I remember this so vividly, and it was a picture of the implant. It had a valve on it. So if they needed to inflate or deflate, they would do it via the valve and a needle and just syringe out or syringe in more fluid, like saline, or take it away if the breast was too big. So that seemed all fine and dandy. There was going to be a drain, which gets rid of the excess blood and stuff. Less bruising, less hematomas. Very good. And that was it. We booked in. I think I was about 16 because I missed some of my lead up to my GCSEs. Went off, had it done. I had my recovery. It takes about 6 weeks to fully recover from surgery like this, because what you don't realise is it's all internal. So while your skin may look amazing and your scar may have healed, think about what they've done to you inside. And please don't rush your recovery, because you will just tear things and it gets messy. Just relax, enjoy your time off, chill, rest. Don't lift nothing, don't do nothing, don't get it wet, blah, blah, blah. They teach you all about this in your dressing clinics and things like that. So we go back for my general checkup, and the general gist is that it needs to be bigger because the left breast has gone untouched at this point. And he tries to inflate it with saline. Now, somehow, my valve during surgery has flipped. So where you should be injecting the spongy side of an implant, it's flipped, and he's hitting metal as he goes into my side. Now, I'm not a baby, I'm not a pansy, I'm not a wuss, or any of those things you want to call people that can't tolerate a lot of pain. But this sucked, okay? It sucked. And God love him for trying. I think he put that needle back into my side 3 or 4 times, until when he brought the needle out, it was bent and he realised what had happened. Operation number 2. They go back in. They replace the implant, I think, with a non-valved implant. Yeah. And then try and match it size for size. Whatever happens doesn't go right, whatever. Operation number 3, and this is where the bottom half of the photo is taken. They take some breast away from my left. They take some fat away, some tissue, whatever you want to call it, and make it smaller to match the right hand side. Fantastic. Pictures look amazing. We crack on with life. I lose a bit of weight. I lose a lot of weight. I got very sick and I lost a lot of weight. I'm talking stoned. 3 stone, maybe 4 stone. I start feeling air bubbles under the skin. Every time you push on it, lay on it, whatever, it feels like air bubbles. We go back in. Operation number 5. Replace the implant. Tighten the skin. Lovely jubbly. I can't remember the details of all of them. Suffice to say, in 2015, 2016, 2015, 2017, 2015 I got married. The winter of 2017, 6 months after I gave birth to my daughter, I am in hospital again, having my implant removed because it had ruptured. It had ruptured. I'm not quite sure how long this one had been in. Could be 5, 6 years, definitely no more than 10, obviously, because of the timeline. And the saline had leaked all the way into my ribcage, around to my back. It hadn't really spread over to the left, which is good, because they could have been in there digging this stuff out for hours. It had gone slightly down. And the whole reason I had to wait was because it ruptured just before or just after I fell pregnant. So I had to carry this ruptured implant around with my baby, and then gave birth, whatever, back on the list, saw him, yeah, we'll take it out, we'll get it removed. And you know exactly where they have been when you've ruptured, because you can feel where they have scooped out the saline that's leaked from your implant. And the first thing I remember, because this can cause cancer, the first thing I remember waking up and him leaning over and just saying, "You don't have breast cancer." Because a leaking implant, whatever, can cause breast cancer. So, that was good, obviously. And this one is now, 2022? It's been in 5 years, this one, that I have on my right-hand side. They don't last forever. Nothing lasts forever. Even metal implants can go wrong. They can break. They can fracture. They can do everything. So nothing lasts forever. And if you have implants, they will need replacing. Shock horror. I'm now 39. I turned 39 last Saturday, and I've had 10. operations between the ages of 16 and, what was I, 35 when I had Amelia. So yeah, there's probably a long road ahead for implants and things like that, unless science is miraculous and we come up with something that can stay permanent. But as it is, these things, you know, they deteriorate, they lose their volume, they lose their kind of stiffness, and they can become elasticated. Everything can happen to these things. They can pop. I mean, I could hug someone tomorrow and it could just pop. That's obviously like worst case scenario. And if the implant's really old, it doesn't just pop, like just hugging some random person and it just pops. It won't happen like that. So yeah, I thought it was important to make this video because if there's somebody out there, and social media is such a massive place now, and it wasn't when it wasn't even around when I was going through this in the first couple of years of my life, that if somebody is looking for answers, or someone that's got something similar going on, or just to vent and talk about it, whatever, that's not your family, no one's going to judge you, you can come here, it's a safe space. It would have been nice for me to have somewhere to go, like a video like this to watch when I was going through it, just to know that you're not on your own. There are people out there. It's called Poland syndrome. It affects the whole right hand side of my body. It affected my little finger that grew like a hook, almost grew inwards, so it was a bit more like bent. I can't do it now that he's fixed it, but I've had surgery on it. As you can see, this one's a lot fatter than this one. It's been broken twice, and a K-wire put down inside it to try and straighten it. It's had ligaments repaired on it because it used to crack when I used to bend my finger. It does on the left hand. I don't know if you can hear that. Not a big of a deal because I'm right-handed. I used to play racket sports, so every time I would grab my racket it would crack and it would really hurt. So he fixed that first. Then he fixed the shape. All the same surgeon, so very acquainted with him. He has seen me in many a different state, but at this point, who cares? He is there to help me. And what is ironic is when I became a healthcare assistant, I am a trained, qualified healthcare assistant. Once I worked in operating theatres, I actually worked for him. He was my surgeon and I was his healthcare assistant. And I watched him do the surgery that he's done on me. It's weird to watch what you've gone through because obviously you were asleep, you have no idea. But it's eye-opening to know that he is so careful, so, what word am I looking for? Observant, very tidy in his needlework and his stitching. I don't see half of it because he uses dissolvable stitches inside me and they're on the inside, not on the outside, so you don't see them, so it means it's all nicely tucked. Think of it like a duvet. When you're pinning them together, you don't see the plastic clips because they're inside the duvet. It's a lot like stitches like that. And just seeing how patient welfare is his top priority, and that's amazing to see. And I trust him implicitly with everything. I trust him with my life because he's done this. I've got something in my eye. I'm not crying. I do not get upset about this at all. It's just something that happened. To me, it's a relatively common syndrome, I believe. There is a poor little kid on TikTok, and his hands were stuck together. He had like webbing. So if you want to go see his story, check him out. He is, I will drop the dad's, TikTok information in there, because I can't comment on what his son is going through. Obviously, I can only comment on me. But it's Poland syndrome, just a different sort. Obviously, I had it on my breast. He's got it in his hands. It seems to be, relatively common. And you can look it up if you feel like you've got something similar. Poland, as in the country, syndrome. And you will find out a lot of information on Google. Don't panic about it, really. It's nothing to worry about. And most things now, due to plastic surgery, can be fixed. So that's the health side of things. But if you wanted to go private and you wanted breast enlargements or breast reductions, it is something that you really do have to think about. It's painful. It hurts. Okay, I've had 10. And I had both done at the same time. I've had the left done, then I had the right done, then I had them both done again. It sucks. It absolutely sucks. And for the first 2 weeks, I'd say, you can't lift nothing. You can't get yourself on the toilet, off the toilet, in the bath, in the shower. You can't get in the shower anyway because 9 times out of 10 they give you dressings that aren't waterproof, so you've got to climb in the bath. Then you need someone to help you get out of the bath. You can't lift like a boiling kettle. All of these things, because it's all to do with the muscles under your arms and your breast muscles in particular. They get worked on, okay? They're around the same area and it hurts. So think about it. It's a lot of money to do it privately. If you're doing it because they're too big and you want them smaller, go for it. It's going to probably make you feel better, enhance you, maybe your self-esteem, whatever. But there will be scars. There are scars. Always scars. So if you're okay with losing some breast for some scars, go for it. If you want to get them bigger because they're too small, think about it first. Implants do not last forever, so you have it done now. Bearing in mind something could go wrong and they could rupture like mine did. You've got, what, 10, 15 years. Then you'll have to pay again and get them done again. Because if you get them removed, you've got to get the saggy skin removed because you've stretched the breast skin. So every single aspect of surgery, especially breast surgery, needs thinking about. Really think about it. Write down a list. Pros, cons. Fill it out. Which one's got more answers to it? If the pros is bigger than the cons, go for it. Do it. Seek a very good surgeon. Research it. Google it. Go for loads of different consultations. Make sure he or she is the best surgeon for you, because they should not be deterring you from your decision. All they can do is enhance it with more information. So they can add to your pros, they can add to your cons. Some cons are obviously numbness around the scar. I haven't been able to feel my nipples since my first operation. No big deal to me. But if you like sensitive nipples or you have them and you don't want to lose them, don't get them operated on. I wasn't able to breastfeed my child because I didn't produce any milk. I'd had so many surgeries at this point that all of my milk ducts were just cut. They were cut away. They were gone. They were severed. So there's no breastfeeding. Again, that's fine. As long as my baby is fed, I don't care. I don't care whether it's by a bottle. I don't care whether it's syringe. I don't care whether it's breast. Fed is best. Don't care what kind of way it happens. Okay, that's just my personal opinion and my baby. That was how it went down. Bottle fed. I slept. Husband fed. It's just the way it went. Think about it. Research it. Do your research. I cannot stress enough, because I went through the NHS, I got what I was given, but he was amazing. His name is TCTO. You can look him up online if you want to. He does private, he does NHS, but I don't know how long he has left in the industry, because he is probably quite old now. It's obviously when I had my surgery done, it was 20 years ago now, plus 25 years ago. So, yeah, he might refer you to one of his registrars or something like that. But as far as I'm concerned, he's the best. And I worked in plastic surgery as a healthcare assistant, and seeing all of the surgeons that I saw, I would still pick my surgeon. Just because his bedside manner is not amazing. You will get close to him very quickly, but he's not a chatter. He doesn't want to chit chat. He wants to come in, tell you why you're there, discuss it, and go and see the next person. That's absolutely great. His cons, he's quite slow. It's taken, I've been in surgery 8 hours before when he did both breasts. My quickest, I think, was 2.5 hours for one side. He's very thorough, which is what you want. It doesn't really matter how long you're under anaesthetic for. You've got an anaesthetist that will look after you. Make sure you get good results. Look after yourself. Make sure it's not some guy in Egypt charging you £100. Do your research, okay? There are NHS websites. You can look at clinics. You can go for free consultations if you like. There's seminars that you can go to. Everything is available now. There's Bupa. There's so many clinics that you can go to. And I'm just solely talking about breast surgery because that's my background, if you like. But if you're interested in any plastic surgery, do your research. It goes for everything. Everything. Research, research, research. You can always look up any surgeon online, and they have to have their information online so they are traceable, so you can find them, so you can learn about them. That's the whole point of the internet, isn't it? So we can learn more about things. So that's it, really. I'm going to just wrap it up there. 20 minutes. I've warbled on enough. My throat is killing me. I'm going to go do another COVID test. Yeah. I hope it's been insightful. If anybody searched this video for this reason, don't be ashamed, okay? They're just boobies, okay? Everybody has them. Even men have a nice pair of boobies, and I've seen them been reduced in surgery before because men aren't happy with the size of their breasts. Perfectly fine. There's nothing wrong with that. Don't be ashamed. Go to your doctor. That's what he is there for. So if you're only growing one, regardless of your age, absolutely go get it checked. And they will just refer you to a specialist. But you know what? I've got them out so many times now, it doesn't bother me who sees them. And that's part of the problem. You become disassociated with them. They're no longer mine. They're Grinstead's. They live in that hospital. They weren't useful to me when I had a child. So they're just there. They're just mountains that live rent-free on my body. I'm disassociated from them. So if they weren't so scarred up, I'd probably make a bit of money, do you know what I mean? But they're scarred, and I don't particularly like them. But that's life. I have two. They look relatively okay. And that's it. And we move forward. So thank you so much for watching this video. If you have any questions at all, any questions, pop them in the comments. If you want to keep it private and you don't want anybody else to see them, I'm on Instagram. I'm on TikTok. Where else am I? I'm on Twitter as well. Not that many people use it anymore. And it's just people just trash talking. I'm everywhere. Go find me, send me a private message, and we can chat. All right? Don't stress. Everything will be fine. I am living proof that we are all okay. All right? Thumbs up. Thank you so much. I hope it's been insightful. Please, if you have any questions, just ask. Okay? I'm an open book. Literally. Anyway, take care of yourselves. Mwah! My beautiful little community that's growing. I'm so happy. I'm so happy with this, with how this is going. Anyway, take care. See you soon.